Back, because it doesn't contain nicotine, it's pretty common for people to think marijuana may have or may be safer for your heart and cardiovascular system than cigarettes.
But let's talk about a new study where it shows people who use marijuana are at an increased risk of heart attack and stroke. Dr. McGeorge joins us now with the latest details.
Yeah, Karen and Damon, because marijuana was illegal in the U.S. for so many years, research into both its harms and, frankly, its benefits is not as far along as research into other drugs and medicines that have been around just as long. But with legalization, we are quickly learning more about how this now fairly common drug works for its longer-term effects.
A new study shows people who use marijuana double their risk of dying from heart disease. In the study, published in the journal Heart, European researchers analyzed medical records of 200 million people between 19 and 59 years old. They found people who use marijuana had a 29% higher risk of heart attack and a 20% higher risk for stroke compared with non-users. The study doesn't provide any insight into a specific cause, it only shows an association. But experts speculate that the smoke itself contains harmful compounds, carcinogens, and particulate matter that are behind the problem. Now, this study could not identify how the cannabis was used, but the authors assumed it was mainly smoke. A completely separate question is whether active components like THC and CBD that might be used in the form of a lotion or edible would cause the same concern. That answer is not clear, although there is some early research suggesting THC does have an effect on the lining of blood vessels. While more study may be needed, some experts say it's time to rethink the potential harms marijuana use may cause, especially if heart disease is a concern.
Now, more awareness of potential risks behind cannabis, THC, and CBD use is really important as it becomes a much more common choice in our society. The benefits to pain relief, sleep, mood, and even inflammation, they need to be weighed against potential downsides, especially for heavy users, and hopefully more research will continue to really help clarify this issue.
Now, there's talk about marijuana and the potency with THC and CBD. Is there a concern about that in terms of how that all plays into this?
Yeah, so there actually is. I think there's a couple of reasons. First off, the biggest reason is the potency is leading to a lot of ER visits as people quickly figure out that today's cannabis causes more extreme effects than, say, yesterday's cannabis. But relative to cardiovascular effects specifically, it really depends, or is going to depend, on how the research shakes out regarding THC and CBD's direct effect on our heart and blood vessels. And you're really going to have to stay tuned for more information on that.
All right. Doc, we appreciate it.